Welcome to my first live YouTube. My name is Dr. Shana Powell. I am a naturopathic doctor in the state of Colorado and owner of West Elks Wellness. So, I want to give a little bit more background to my story and why I care so much about severe acid reflux. I'm not talking about the type of acid reflux you get because it's Super Bowl Sunday and you're drinking too much beer and having too much pizza and hot wings with ranch dressing and you feel terrible the next day, or maybe you have acid reflux going to bed. I'm talking about the type of acid reflux that no matter what you do, you listen to the doctors, you take the medications, you chew your food, you do what you're supposed to do, and you still have acid reflux. It's so mind-boggling because anybody that's experienced it, recently my husband, he took a digestive enzyme and it got stuck in his throat and he took it too late after a meal and that caused some acid reflux situation. Okay. He was like, I don't know how you lived with that. I lived with that sensation for 8+ years on a daily basis, all the time. It would keep me awake at night. I slept on a wedge pillow, right? Those are super sexy, really uncomfortable. So severe acid reflux. I also had my senior year, the summer before my senior year of high school. So I'm what, like 17, 16, 17. I turned 18 my senior year. 17 years old, and I had been to the emergency room 2 times at this point. The first ER doc was like, "Oh, you're drug seeking." I'm 17. Like, I don't want your pills. Like, I lived in East Tennessee during the opioid epidemic when it was like really hit, and I have middle school friends that overdosed and died from that. Like, that's not what I was doing. Like, I was in significant pain right here. Like, really, we call this the epigastric region in medicine. This is the epigastric portion of your abdomen. Very pinpointed pain. Okay. At this point, I had had a number of imaging done. I hadn't had an EGD yet, but I had had a X-ray, or excuse me, an MRI of my abdomen, and nothing showed up concerning. My third emergency room visit in the same summer, so in like a month period, the pain that I was in was excruciating. I weighed under 100 pounds. I was maybe like 95 pounds. Couldn't eat. Loved to eat. This wasn't about like, no, I can't eat. Don't want to eat. It was if I ate, my stomach felt like it was burning and like ripping itself into shreds. It was such a gnawing, gnarly pain. Turns out that young, maybe in his 40s ER doc was like, kind of sounds like you're having stomach ulcers. One of the other docs, the second doc that I saw was like, oh, you're too young to have stomach ulcers. That's what it sounds like. Just take an antihistamine. Who knows what's wrong? Didn't do due diligence. That's the problem that I saw with those two other practitioners. This third guy was like, sounds like you have stomach ulcers. Here's a GI cocktail. It had lidocaine, probably sulfuricate, and for the first time in literally months, I could eat. And you bet your bottom, I was like, let's go eat. Like, I was with my then boyfriend and his mom, who took me to the emergency room in Pueblo, Colorado. I wish I remembered that ER doctor's name because he saved my life. And so from then on, like, okay, I started figuring out ways to treat the stomach ulcers, because the medications, I was having bad reactions to them. That sucked. So that was kind of like a culmination at 17. But before then, the first antidepressant that I got put on was Zoloft. I was 11 years old. Okay, so kind of the symptoms I had growing up, I was diagnosed with asthma when I was like, 4 or 5 or something like that. I had really bad asthma attacks. I was on a nebulizer, which is the thing you plug into the wall to nebulize albuterol. And I had an emergency inhaler that I kept with me at all times. I eventually ended up on an Advair Discus and Singulair, now Montelukast, which, by the way, has a new black box warning as of 2020 for neuropsychiatric problems that are pretty severe. And I do think that played a role in my mental emotional issues. Okay, so eczema, asthma, severe allergies. Like, I was super allergic to cats. I was allergic to dogs. I was always having to wash my hands. We really didn't have the green, clean, chemicals. We used like Windex, and Febreze wasn't around when I was super little, but as I got older, we used that. Bleach. Oh my God, so much bleach in the house, and like probably using too much bleach per like bottle, and per load of laundry. Like if you use it, you're supposed to use like a small amount, like a capful, half a capful type of a situation. Okay, so eczema, allergies, and asthma, those were like the first diagnoses I had. Then the mental emotional issues, the anxiety, like the severe anxiety that I had, and depression. So age 11, diagnosed with anxiety, was put on Zoloft, which is an antidepressant. And a lot of people come to me and they say, oh, I'm on anti-anxiety medications and it's an SSRI, selective serotonin reuptake inhibitor. They're used interchangeably, whether it's off-label or not, it doesn't matter. Drugs.com is a great reference. Let's see. So age 11, fast forward to age 13. So I had been on a number of different antidepressants up to this point, and they decided to try Paxil on me. And this was prior to boxed warnings getting put on antidepressants for pediatric patients, to say, hey, like be mindful with pediatric patients. There's an increased risk of suicidality, suicidal ideation, violent behavior, et cetera, et cetera. Within 3 months, I was put on the highest dose of Paxil. My mom was on the lowest dose. She'd been on it for 10 years. It was not a good summer. So that was the summer before, let's see, my freshman year of high school. So before I was in ninth grade, I had attempted to overdose on pills twice. If I knew now what I know, I would have been successful. That third one, I had, you know, some kind of divine intervention. I've talked about it on podcasts with other guests before, so I'll save you guys that bit. And I knew that something was wrong. Like I knew that these medications, at a young age, I knew these medications were a problem. So I started researching. This was kind of before Google, but you could go online and go to Yahoo search engine. And I was searching. I was like side effects of, whatever medications I was on. I was on a number. So 3 different asthma medications, over-the-counter Benadryl as needed. Let's see. I was on that antidepressant Paxil. This was the beginning. This was before I got put on all the rest of the crap. So at least 4 medications and 1 over the counter. I was also in a lot of pain. I had like lots of joint pain, so I was taking ibuprofen, Motrin over the counter pretty regularly. Yes, at age 13, I was dealing with that diagnosis that came later that helped me understand why I had chronic joint pain at such a young age. And I went to my psychiatrist and I said, "Hey, like I'm having these side effects from these medications. I think the medication is the cause." And he was like, "Honey, we have you on this medication, so you don't need to worry about that." He told me not to worry about it, and the reason I was medicated was because I had such severe anxiety. I will never forget his name because he did not listen to me. He did not trust me. He just was like, "Okay, little girl, like you don't know, it's fine." And it wasn't fine. So fast forward to today. Actually, I just learned about this diagnosis 2 years ago. It's called antidepressant withdrawal syndrome. That can look like bipolar disorder with mania. That was bipolar disorder 1. They didn't have 1 and 2 back then in the diagnostic criteria. So I got diagnosed with bipolar after I was removed rapidly off of the Paxil, after my psychiatrist was informed of my summer activities. And so then I was diagnosed with bipolar disorder at age 14. And I was put on 2 medications to start, Abilify and Lexapro, and then I was put on Lamictal, which is called lamotrigine, and quintiapine or Seroquel. And I'll tell you what, Seroquel is a crazy drug, and they were doing high doses back then. That was 500 milligrams twice a day. Really difficult to stay awake in school. This was kind of like the beginning of the new generation of antipsychotic medications, and I'll tell you what, like, whew, Seroquel is a crazy medication if you've ever taken it. I definitely have some bias against those new antipsychotic generation, second generation antipsychotics. They don't really prescribe 500 milligrams twice a day anymore, and I haven't seen kids prescribed quintiapine either. So again, fun pharmacological. And here's the thing that really bothered me about that diagnosis. So I got diagnosed with bipolar. I'm in high school now, and I started talking to my other friends that are similar age, and they're telling me they have anxiety and they're on quintiapine. They have insomnia and they're on quintiapine. They have this, and this. It was like just being given out like candy, regardless of what the diagnosis was. And that was really the first time I was like, these medications. So again, I'm like bringing it back to these medications, and even my like little teenage brain was like, this is not correct. Um, so get diagnosed with that. I'm on 4 different psych meds, which if you've ever been on a psych med, you know that those can be full of side effects. Um, 3 different asthma medications. I'm still having periodic eczema breakthroughs, so using topical hydrocortisone cream. They didn't have any of these fancy monoclonal antibodies that they're using now, which I'll save that rant for another day. And then I started having like gut issues. So this was kind of like the beginning of I'm still having asthma. Like I'm still having to use my albuterol inhaler a few times a week. So I would say it's controlled, but like not super well managed, even on the other 2 medications. Um, so then it's belly pain. So IBS is what I get diagnosed with. I'm dealing with like alternating constipation and diarrhea. I didn't understand the physiology of the body at the time. And eventually that turned into severe acid reflux. So fast forward a few more years, I leave home at 16 and I go and live with my sister. My mom was good friends with the wife. My mom was Muslim at this time, and her husband worked for one of the flights, and he helped my brother and I leave my mom's home and head to live with my sister. And the imam of the Knoxville mosque, I don't know if he still is, but I will never forget his generosity and his assistance in leaving a questionable situation. So there's a joke in the site in the counseling world, the psychotherapy world. Is it you, or are you surrounded by assholes? And I will choose that a lot of my mental issues, my anxiety, my depression were contributed to by not being in a safe home environment. And this is something that's so important as a naturopathic doctor is we talk about the environment, the foundations for health. And if you're in an abusive relationship because you're married, or you're in an abusive relationship because you're a minor, or whatever it is, if your relationships are not in a healthy, stable, safe place, it's going to make it really difficult to get well. I don't care what your condition is. I've had a number of colleagues recently share stories with me that was like, they're both of them were female stories, female patients. They divorced their husband, they quit their job, and they moved away, and all of their health issues went to the wayside. Like they no longer had diagnosable health issues. And that sounds so extreme, but those very hard things, and I've talked about this before with Tia on my one of my spiritual intuition podcasts. You have to be uncomfortable enough to make that big change. And at 16, I was uncomfortable enough to say, I can't do this anymore. And I didn't have the resources. I didn't know how I was going to get out of there. I had concocted a plan to run away with some friends, but that wasn't until a few months later that was going to be initiated. Things kind of hit the fan full speed ahead, and I had to get out of there sooner than later. I would say it took about a year to come down from the side effects of all those medications I was on. Let's see, when did I lose my insurance? I was 18. So a few years later, I couldn't afford to stay, and I was on trade name, all these medications. This was back before you could buy omeprazole over the counter. So that was a trade name medication. I was taking a proton pump inhibitor for acid reflux. I was taking 20 mgs twice a day and still having nighttime regurgitation. Like it just felt like my throat was freaking on fire. So I was over medicated. I see a lot of patients that are over medicated, especially my geriatric clientele. They kind of get thrown into a corner. Here's your 4 high blood pressure medications. You'll be fine. Well, your blood pressure is all over the place, and actually one of your other medications is causing the high blood pressure. So it doesn't matter how many antihypertensive medications you're going to get given, you're going to have high blood pressure because it's a side effect from one of the other medications that you're needing to take. And we're just not having those conversations. The whole reason I wanted to share my story is today, you know how many medications I'm on? 0. Um, I recently have had an eczema flare up, but I think there were some other components to that. It's like my predisposition to have this skin issue. I was dealing with a lot of stress, the birth of my son, et cetera, and so that was a contributing factor. I'm not going to take corticosteroids. I put tallow cream on it. I used a mild soap to wash it, and I really do my best to try not to itch. Okay, and I can still see it in the corner crevice of my elbow, where it's there. If I itch it, it will definitely show. Medications cause problems, and the fact that we live in a society where we live in the United States, a billion people less than China and India, and we consume 70%, almost, it's 66% last time I looked at the stat, of the world's manufactured pharmaceuticals in this country. That's insane. And it's not because we're sicker. It's not because we need them more and other people don't. It's because we've become a society that cannot handle any amount of discomfort. And I'm not saying you need to do it the way I do it, but I am saying that we need to think about it before we decide we need that antibiotic, before we need that corticosteroid, before we take that proton pump inhibitor. Is there something that I'm doing that's contributing? One of the biggest factors for asthma that I was experiencing, and I would also put allergies into this category as well, is the toxic cleaning chemicals I grew up using. Lysol, Windex, um, the crazy sprays that we used in the kitchen, anything that aerosolizes, you're inhaling. If you're using blue, smelly toilet bowl cleaner inside your shower with poor ventilation, you are inhaling that and causing lung damage, lung irritation. Okay. Like that's a major issue. We don't think about that because, I'm fine. I don't have that issue. Like I don't have any lung issues, but what's the effect that it's having on the next generation? It was pretty severe in my case, and I've seen patients where the only thing we did to clean up their environment was change their cleaning chemicals. For a long time, I used distilled vinegar. It doesn't work on all surfaces, especially if you have really nice stone or granite countertops. It can damage them. So something like Branch Basics, I'm a big advocate for. It took me a while to buy them because it's a little bit pricey, but you buy the concentrate, and I clean my house fairly regularly, and we can have a bottle of that concentrate that lasts almost an entire year. Okay. So $60 for a year, that's way less. Like you think about all the Pledge, Windex, Lysol, the bleach, all these things that you're buying on a regular basis because you're overusing them. Vinegar, a couple drops, a little bit of vinegar and some water, spray your windows, works incredibly well. In my opinion, much better than. And if you live in a place like Colorado with hard water, CLR is enzymes that break up the calcium, lime, and rust. We have really hard water where I live, and so cleaning like the glass shower door, sometimes the toilets can be tricky. I just use that Branch Basic concentrate to clean everything, and they have a various concentrations that they use that you dilute, whether it's for your bathroom or general use, which is what I use in my kitchen. I'll use a bathroom cleaner in my refrigerator because EU refrigerators get nasty. Uh, it can be that simple, and vacuuming in the morning, not in the evening, that kicks up all that dust. Having an air filter, I've seen people's eczema completely clear up. Now, the last bit that I haven't discussed, because there's so much like conflicting information out there, I cut out what is now referred to as seed oils back in my early 20s because I was still dealing with the acid reflux, even though I was doing the medications. I stopped all the medications when my Medicaid ran out at 18 prior to the Affordable Health Care Act coming online. And by then I was already medication free, and I was definitely not going back because the psych meds scarred me because of the experiences the side effects that they caused. And they were pretty freaking severe if you ask me. Like I said, montelukast singular just got that box warning a few years ago. And I was prescribed that when I was like 10 or something like that, right when it first came out. I was pretty young, to be honest. We didn't know anything. So where I'm getting at with this, before I go to explain about seed oils, is you need to do your own research about medications. Your doctors are going to do the best they can, but you got to remember that the sales reps for those drugs are the ones in their office dropping off material. That's biased material. It would be better for you to do some digging yourself and look at it and do your discernment. That patient that I mentioned with the blood pressure, she's doing her own digging, and she's like, hey, I actually don't think I have high blood pressure. I think it's from this medication. And she's having to Go back to her prescribing practitioner and say, hey, look, I'm concerned about this. What do you think? Which is the right thing to do, as opposed to stopping medications cold turkey, some of which, especially the segments, can be quite dangerous. Now let's go back to the seed oils. Back then, what I was trying to get rid of was the omega 6s. So our ancestors, however you want to look at it, and I don't call it an ancestral diet because the food that we eat today is nothing like what our ancestors ate 100, 200, 500 years ago. Not even nothing. Everything has been so domesticated, and the avocados are way bigger, fruit is way bigger, blah blah blah. Bananas had seeds, they don't have seeds anymore. You get the gist. But these omega 6 rich seed oils, our omega 6s are far more inflammatory. They trigger something through the arachidonic acid pathway, which is a pathway how inflammation gets going in the body. Something like a COX inhibitor, like ibuprofen or Celebrex, celecoxib, will inhibit some of that breakdown and reduce some of the inflammation that way. But what about omega 3s? So things that are like olive oil and coconut oil and good fatty fish like salmon. These things are high in omega 3s. They are purported to be anti-inflammatory when actually they're just less inflammatory than the arachidonic acid producing omega 6s, like canola oil, safflower, sunflower, peanut, etc. The other piece with the so-called seed oils is the deep frying of things is a major problem. Trans fats have been banned primarily as an added ingredient, but if you get anything deep fried in oil that's been reused, which the worst job I had was at McDonald's, and the reason why is because I learned some dirty secrets of the industry that were gross. Okay, they're supposed to clean and put fresh oil once a week, and they just top it off and filter it. They never actually put fresh oil, at least in the one that I worked at. And that really disturbed my soul because someone that has a seafood allergy, it just ew, it's just gross. Okay, be mindful of that. Trans fats are naturally made when you deep fry foods and you're using old oil. Okay, so it's becoming rancid when it's been used. Oxidized is a better word. Oxidized. Anything that's oxidized, think about rust on metal that's been sitting out in the air, in the rain. That is a problem in our body that creates inflammation in our system. Okay, I don't see. I see that seed oils, so-called seed oils, omega 6 rich foods, are a big problem with people dealing with severe acid reflux. So if you have severe acid reflux and your primary cooking oil that you have is so-called vegetable oil, whatever the hell that means, sitting on your counter by your oven, throw it away. And I would recommend buying a good quality extra virgin olive oil. And if you want to do a little bit of like sauteing or something like that, use butter, use beef tallow. These are things that I don't see people having adverse health reactions to. And the whole thing about your cholesterol, which is so fascinating to me, 80% of cholesterol is produced in the liver. Okay, it's produced in the liver. 20% is based on what you're putting in your mouth. Now, if you're eating a bunch of deep fried foods and that's primarily the thing that you're eating, that's going to really affect your cholesterol. But I think it's more because of the oxidization of the fats rather than the fat itself. If you had like good quality for cold pressed organic canola oil that wasn't genetically engineered and wasn't over fried, I think it would be much better. So my number one recommendation for people dealing with severe acid reflux is to throw away your vegetable oil and opt for something like a good quality olive oil. It's a good quality when you put a little bit in the fridge and it solidifies. That's a good sign. That's what you want. You ever had salad dressings that you make that happens too? And yeah, you're going to say, oh, salad dressings, oh, all these things are so hard. Suck it up, figure it out, make your own salad dressing. It's not that difficult. There's plenty of recipes online. I know it's a busy world. I get it. And excuses, everybody has them. Like, if you really want your health back, you have to stop making excuses for yourself, and you have to have a little bit of what's the word I'm looking for? Deliberation. No. Intentionality about how you live your life. And unfortunately, we live in the United States where there's a bunch of garbage that's being sold in the grocery store to us as so-called health food. And there's a meme that goes around that's like, oh, if there's a health food section in your grocery store, what is the rest? Michael Pollan, Shop the Outside. the perimeter of your grocery store, vegetables, meat, dairy, grains as appropriate if they work well for your body, and only going into those aisles when you need something specific, like if you use tomato paste or whatever. And yes, you can have tomato paste as someone dealing with acid reflux. Really recommend removing those omega-6 so-called seed oils. So that's the story. Medications, do your due diligence. Omega-3s are better for you for reducing inflammation, and heavy omega-6 diets are a big contributing cause to significant gastrointestinal issues. Thanks, everyone.